Good evening, everyone, and welcome to Silver Talkies presents all you need to know about kidney and liver health. As most of us know, kidney and liver are two of the biggest organs in our body, and they require as much equal care as our heart and lungs do, or any other organ for that matter. It is essential for us to be aware of the risk factors that can adversely affect these organs and the various ways we can keep our kidney and liver healthy, especially as we grow older. So to know more about it, we have a familiar face with us today, Dr. Tausif, who has spoken to us earlier on various health issues very, very patiently. Thank you for being here, Dr. Tausif.
Thank you.
It's there. Thank you, Doctor. And today's event is, we have held events with NURA earlier. And in today's webinar, we will, look at functions of the kidney and liver, risk factors, prevention of those risk factors, and lifestyle modifications. A little bit about Dr. Tausif and NURA. Dr. Tausif, as most of you know, has also been a radio jockey. And he is the other hat, the very critical hat he wears is as the medical director and general manager of NURA. NURA is a collaboration between Fujifilm Healthcare and Dr. Kutti's Healthcare. And they are bringing you the best of AI-enabled imaging and expert healthcare. We'll know more from Dr. Tausif in a bit. A little bit about Silver Talkies. Most of you are, of course, very familiar with us. But for those signing up for the first time today, Silver Talkies is a social impact organization. What do we mean by that? Well, we work with older adults and we try to bring in some impact in their life through social engagement and by highlighting talent and passion and their skill. And we do all this through our, our digital magazine, through our events, activities, workshops, classes. We hold number of classes throughout the week. And most importantly, through our virtual club, Silver Talkies Club, which is open to anyone above the age of 55. Our mission is to engage, empower, and encourage diverse experiences. And you can ask many of our club members who are here that they will all tell you what a vibrant, buzzing, and active group we are. And now that we are virtual, you can join us from anywhere in the world. So thank you all very much for attending and welcome to Silver Talkies Live. Over to you, Dr. Tausif.
Thank you, Reshmi. And as always, like I say, a pleasure to join the Silver Talkies group for another webinar. And I'm always sure that at the end of the lecture, I will get a lot of questions. Happy to answer any of them.
It's a pleasure for us too. Thank you very much for being here.
Thank you. All right. So let's not waste any more time. And I'm going to go ahead quickly and start sharing my screen and take you through my presentation. And then we'll have more time for questions. Now, the kidney and the liver are two big topics. I'm trying to see if I can cover as much as I can in half an hour, and hopefully any further questions that you have, I will answer at the end of the lecture. Okay, so the lecture is all you need to know about kidney and liver health. My name is Dr. Tausif, and I am a NURA. I'm the medical director and general manager. First and foremost, the human liver. It is the second largest organ in the human body, weighing about 1.5 kgs. If you're wondering which is the largest organ in the human body, it's the skin. It's your skin. That is also an organ, and it is the number one. And liver is the number two organ. And it is placed just behind your rib cage, just the lower part of your rib cage, as is visible there. And it cannot be felt on the outside. If it is felt from the outside, then that's abnormal. So usually it's safe, protected, hidden under the rib cage on the right side of the body. Now, some things about the liver that you must know is the liver on a daily basis carries out 500 different functions. We're not going to discuss all of them, but in a nutshell, I'll tell you some of them. At any given point of time, the liver approximately holds 10% of the blood supply or the blood in our body and pumps nearly 1.5 liters through itself per minute. So 25% of our body's blood supply goes through the liver. And at any point of time, if you take out the liver, it's going to have 10% of the body's blood supply in it. So that's a very, very vascular organ. Like I said, it's the second biggest organ next to the skin. And most of the diseases of the liver are preventable. That is the amazing thing about the liver. And most diseases are very, very silent. Liver diseases are silent until it's a little too late. And it produces bile. Bile is very useful for us to digest all the fat and the cholesterol that we eat. Without bile, we cannot digest the fat or the cholesterol. And it is the only organ in the body that can completely regenerate. So when we are donating liver to another person, only a part of the liver is taken and put in the other person because a liver can regenerate itself. So that is the beauty of the liver and the way it has been created. Okay, so let's move on. So what does the liver do? So out of these 500 functions, I'm going to show you some of the functions that the liver does. Don't focus on the last boxes, but there are three major functions of the liver. One is biotransformation. What is biotransformation? So we have a lot of toxic, metabolites and end products of our digestion and metabolism that we have in the body. The liver allows us to transform them into non-toxic substances and then allows us to excrete them either to the stools or through the urine. Ammonia is one example. Hemoglobin with RBC breakdown is there. Most of the drugs that we take, antibiotics that we take, glucose, handling glucose. Liver plays a very, very crucial part in handling glucose in the human body. Storage. All the excess glucose is stored as glycogen in the liver. The vitamins that we have, especially the fat-soluble vitamins, A, D, E, and K, all of them are predominantly or primarily stored in the liver. And any fat, the first place of storage is the liver before it starts going to the other parts of the body. And you must have all by now have heard the term fatty liver. So we'll talk a little bit about fatty liver as we go forward. And of course, synthesis. It produces proteins like albumin. Urea is produced in the liver, and a few growth factors are also produced in the liver. Okay, right. So here we go in a more detailed manner. We produce hormones in our liver. We do red blood cell decomposition. We do cholesterol synthesis. We store glycogen. Glycogen is when you have excess glucose that becomes glycogen. Proteins get synthesized. We store iron. We have bile that is produced there and allows us to digest fat. All toxins in our body are deactivated in the liver. Glucose, vitamins, all of these have to pass through the liver. So it's a very, very important organ. And then this is again more detail. So I'm not going to go in further, but as you can see, the liver does a lot of work in the human body. Okay. So liver damage. When I say liver damage, what does liver damage mean? So in a usual person who's not drinking alcohol, if they are undergoing liver damage either due to some infection, inflammation, some hereditary problem, then the healthy liver will first get into a feature called as fatty liver. Fatty liver means the liver is getting damaged and fat is getting deposited in the damaged areas. So this is inflammation that's happening, it's hepatitis that's happening. Okay, so this fatty liver, after the damage, when it tries to heal, it may or may not generate the liver parenchyma. So it will become fibrosed. It's like getting a cut and then developing a scar. So that scar is called fibrosis. So the liver becomes fibrosed. And if that progresses, it goes on to become cirrhosed, or a cirrhosis of the liver means a completely damaged liver. The liver is completely gone, unfortunately. In people who drink alcohol, on the other hand, you have normal liver that goes through inflammation, what we call steatosis, and then the liver cells start getting damaged. And this damaged liver will then try to heal by fibrosis, cirrhosis, and then progress to carcinoma or liver cancer, hepatocellular carcinoma as we call it. So after cirrhosis, there is hepatocellular carcinoma, and this is in alcohol-related liver disease. So these stages, when we are in the stage of inflammation or in the stage of fatty liver, the disease of the liver is reversible. So it's best for us to identify it at that time and immediately remove the insulting organ or organism that is causing it, and then make sure our liver is healthy and protected. In fact, alcohol, if it is damaging our liver, it would be high time for us to stop that. So what are the causes for this? Let's look at some of the causes for liver damage. So there are different types of liver damage, liver disease. One is the jaundice that we always see. Everyone knows about jaundice and the liver. So everything starts becoming yellow. More often than not, it's the eyes that reflect it first. And then, of course, the skin, the tongue, the nail beds, everything can become yellow. Jaundice has different reasons. The liver can be damaged, or there can be damage to the red blood cells that's happening, or it can be some obstruction like a gallstone that can cause it. Then there is viral infections like hepatitis A, B, C, D, E. The good ones are A and E. They are foodborne. It's food and water. If you are eating outside and it's contaminated, then you will get hepatitis A and E. Self-limiting, a lot of nausea, vomiting, but it settles down, no permanent damage to the liver. But B, C, and D are dangerous. They are bloodborne. They travel in the bloodstream or fluids, and then they can get transmitted, and it's very difficult to get rid of them. They can also lead to cancer later on. So we have to be safe from B, C, and D. That is why we take hepatitis B vaccination. Of course, this can then progress to liver failure or liver cirrhosis, as we call. Sometimes, without going to failure, the liver can get enlarged. There's hepatitis or hepatomegaly. There's also hepatic encephalopathy, meaning when the liver is getting damaged, the brain will also get affected and the people start behaving differently, right? And then the liver damage also causes a lot of fluid to accumulate in the belly of people who are affected with liver diseases. This is because their protein level drops down. The liver produces protein. There's no protein, so fluid leaks out and it fills up in the belly. And yes, it further on can lead to tumors or cancer. So these are the different types of liver disease that we can see. Right. Okay, so here it is, some of the common causes and liver disease. So alcohol-related liver disease, regularly drinking too much alcohol, well, that will cause alcohol-related liver disease. Non-alcoholic fatty liver disease is if somebody is overweight or obese. So this may cause fat and glycogen to accumulate in the liver, leading to fatty liver, and then cause more damage to the liver. Also, losing weight rapidly, I think there's one of the slides, that can also cause fatty liver. So it's both ways, yes. Hepatitis, usually secondary to viral infection, but also can be happening could be happening due to alcohol consumption. Hemochromatosis, now this is a genetic disorder, and here there is a lot of iron getting deposited in the liver, again damaging the liver's ability to function. And primary biliary cirrhosis also is a childhood disease, and it can cause a problem with the immune system. Right. Okay, so causes of fatty liver. So let's just focus on fatty liver for a second. Yes, it can be either obesity or rapid weight loss. Yes, so both can cause a problem. So don't think just obesity is a problem, but if you're a certain weight, we always advise you to lose weight gradually. Maybe about 4 kilos a year or 5 kilos a year is ideal, rather than these crash diets where we're doing 10 kilos all of a sudden in 2 months or 3 months. That can also lead to fatty liver. Sugar, if you're not controlling diabetes, that will also lead to fatty liver. A lot of fat in the blood, which happens either because you're eating too much fat or your body is not able to handle the fat, that can happen. And medications. So a lot of toxic medications, if you're taking, that will also affect the liver. So all of these can hurt or harm the liver and cause fatty liver. Okay, so your risk factors are heavy alcohol use, injecting drugs using shared needles. This is how hepatitis B spreads, or hepatitis B, C, or D. Tattoos or body piercing. So people in your family are getting tattoos, tell them they make sure that they get it from the right place, because the people need to use sterile needles. Otherwise, if shared needles, again, it will cause diabetes not being controlled, toxins, and obesity, like I said. Symptoms of liver disease. What are the common symptoms of liver disease? So if we all know jaundice, yes, but apart from that, the urine also turns really yellow, or in fact, it may be high colored, as we call it, bordering on red. But the stool, the motions, on the other hand, will become pale, right? So somebody is having liver disease, the urine becomes really dark yellow or high colored, or and the motions becomes pale, it loses its color. People can also have diarrhea, abdominal pain if it's an acute liver injury, so there'll be hepatitis, so there'll be abdominal pain and swelling. They'll have a lot of nausea and vomiting, and we know that already. Anybody with jaundice or liver problems will keep on vomiting. They cannot keep anything down. And there can be an unexplained weight loss or gain. Both can be there, because there's poor digestion. They can lose weight because the fluid is accumulating in the belly. Then they can look like they're putting on weight. They'll have a lot of itching on the skin, especially when more and more bilirubin is accumulating. And obviously, they're not going to feel hungry. And of course, if this affects the brain, then they go through different stages. Initially, there is loss of sleep, and then there is confusion, irritation, and then they can have hand tremors, we call asterixis. They start becoming drowsy, stuporous, comatose, and then slowly death happens. So this is when this level of ammonia goes high enough to affect the brain. But before that, the symptoms that I mentioned will be there. Only later on, these symptoms happen. Okay. So what is the global burden of the disease? Luckily for liver disease, India is not that big a center, right? We are in the blue, as you can see, per 100,000 or 1 lakh population, we are less than 500 per 1 lakh population. So we are about 0.5% risk or 0.5% prevalence. So liver disease not so big in India, but in some of the other countries in the world, especially Russia, Africa, Central Europe, a lot of liver disease that we see. India, thankfully, not so much. What is the reason? I don't know, honestly. We really don't have too much data just focused on India for us to tell why Indians are relatively protected from liver disease. But it is growing. Even in India, it is growing. If you're looking at the data from 1979 to 2004, it is a steady upward trend. So more and more people are coming down with liver disease. We probably might have not have heard about it, back in the days, but nowadays we hear more and more people having liver disease, more liver surgeons, liver transplant people. They're all available around us. Yes. And what I want you to focus on is this liver cancer in Asia. Again, not as big as the other cancers, thankfully, it's less, but it still exists. Okay, so liver cancer is also something that we are concerned about, but thankfully not such a big problem in Southeast Asia. Okay, some common liver tests in case you wanted to think about them. There is a liver function test panel that every hospital does or every diagnostic center does, where we look at AST, ALT, which tells you whether the cell is damaged or not. The GGT will tell you whether there is excess alcohol being consumed. The bilirubin tells us whether, okay, either the RBCs are getting damaged too much or the liver is able to manage it better or not. And the protein or albumin tells us whether the liver as a factory is working fine or not. Apart from that, if you want to check for infections, we'll do hepatitis A, B, C, D, E, or for clotting or bleeding tendency, we will do PT, PDT, INR. And then, yes, we'll do an ultrasound to see the size of the liver, and a CT scan of the abdomen gives us a better picture. If we want to rule out cancer, we also do a liver biopsy. Okay, so this is the common liver test panel that we have. So how do I protect my liver? Okay, like I said, there's a lot of information, so I'm trying to give you everything in just one slide because I have to touch the kidney as well. Okay, so how? First thing, be careful about alcohol consumption. Make sure if you like your alcohol, make sure it's drunk in moderation. Don't overdo it. Don't abuse the alcohol. Otherwise, it's a surefire way to get your liver damaged. Okay, so that's important for us. Secondly, wash, produce, and steer clear of all toxins. Basically, what it means is nowadays a lot of pesticides are sprayed on vegetables and fruits that we eat. So make sure when you buy something from the market and come, wash it, clean it. Okay, make sure that everything that's on top is cleaned off, and then you can have it. So that's very, very important. So also try to make sure you don't take any medicines that's toxic to the liver. Be very careful about all those things. Discuss with your doctor if you want to, and put the right things into your mouth. Okay, don't put the wrong things. Prevent hepatitis A, B, and C. Very, very important. So make sure you don't eat contaminated food and water, and also no shared needles. Everything should be sterile. Go to the right doctors. Tattoo artists, of course, all of that should be done. Okay, and of course, safe sex. Vaccination is very, very important. So make sure everyone gets vaccinated. So that's very, very important. And watch out for medications and herbs. We have a lot of quacks. I'm not saying that one form of medicine, allopathy, Ayurveda, or homeopathy is good or bad, but in all specialties, including allopathy, there are bad people, like not doctors, but quacks, who don't know how to practice medicine and prescribe wrong things to people. So make sure you steer clear of all these preparations that are just saying, oh, this will do, this will give you hair back, and this will make you lose weight or put on weight. These things, or fertility. These are four of the most common traps that people fall into: fertility, hair growth, weight loss, weight gain. Okay, so be careful. Be careful. Whatever your body is, it's best to be happy with it and not take unnecessary supplements. And also exercise and eat right. And this is true for any disease, not just kidney and liver. Okay, this is Dr. Kellyanne. She's not a doctor, but she's a naturopath to a lot of celebrities in the US. But this is her advice, reasonably okay, except for the liver healing foods and liver supplements. The rest of it is generally good advice, and it's easily available on the net, and you can find it. But the 5 points that I told you, those are the most important to protect your liver. And that's all about the liver. All right, let's move on to the human kidney, and that is the kidney. Okay, nice bean-shaped, beautiful organ. It's located more towards your back, just below the rib cage. It's just a small gap. That's where, just below the liver on the right side and the spleen on the left side, is where you will find the human kidney. And of course, the human kidney is then connected down to the ureter, and through the ureter to the urinary bladder. The kidney produces the urine, goes to the urinary bladder, and then we empty it from there. So that's what we know that the kidney does, but the kidney does much more than that. Okay, so it receives about 20 to 25%, just like the liver. The kidney is also highly vascular. A lot of blood goes through the kidney, and it receives about 25% of all blood pumped from the heart, and it filters about 8 liters of blood in an hour. So it's a fantastic filtering organ. And one kidney can substitute for 2 kidneys. So we can survive with 1 kidney itself. Like we can survive with 25 to 30% of the liver, we can survive with just 1 kidney. And also they produce vitamin D, or rather they don't produce vitamin D. Vitamin D is in the skin, but it has to get activated first in the liver and then again in the kidney, right? So it kind of gives you the active form of vitamin D, which allows you to absorb calcium from the intestine and then helps you build bones. So if there is no vitamin D, bones are going to be weak. So kidneys damaged, people's bones are going to start suffering. And of course, they will continue performing until they have lost about 75 to 80% of their function. So functions of the kidney. Let's look at what the functions of the kidney are. And that is a magnified view of what happens as you go deeper and deeper into the kidney. And this small structure that you see right now is the nephron. That's where all the filtering happens in the kidney. Okay, so it has a renal parenchyma, right? That's where all this nephron and filtering happens. Then all it collects into a collecting system. And then it goes into the ureter as urine and passes out. Of course, it gets its blood supply from the renal artery and the renal vein. And all the functions that it does in a nice, short, quick way. One, I already talked about bones because they produce vitamin D. They also regulate your bone mineral metabolism. So the kidney gets damaged, the bones are going to become weak. Also, kidney helps in red blood cell production. So there is a hormone that is secreted called erythropoietin. So kidney disease patients, you will see commonly taking EPO injections or erythropoietin injections. That is because the kidney produces this hormone, which stimulates the bone marrow to produce RBCs or red blood cells. So if they don't have it, they're going to have anemia. Also, we obviously know that the kidney excretes all your metabolic waste products and excess water that you may have in the body. God forbid the kidney is not functioning, all these toxic metabolites will stay back in, and also water will start getting overloaded in the human body. Of course, it also influences our pH and makes sure that our acid-base balance is maintained. Now, we always are taught about DNA and RNA, that's ribonucleic acid and deoxyribonucleic acid. So everything we eat is acid. And the body works really hard to buffer it and make sure that the pH is maintained in a very narrow range. So then the majority of that work is done by the kidney. So it maintains our pH, doesn't allow us to become too acidic. And also it regulates blood pressure. There's another hormone called renin that is released from the kidney, which affects the heart and says, keep the blood pressure at this level. Okay, if you're not maintaining blood pressure, I'm going to come and then push you to pick up the blood pressure. So all of these functions is done by the kidney, right? So as you can see, when it's flowing, the blood comes in, flows through the nephron, and then when it goes out, there is no waste. So the metabolic waste comes in, and when the blood is going out, it's clearly filtered. And this depends on the GFR, the glomerular filtration rate. That mass of blood vessels you see is called glomerulus. So if the GFR is good, more filtration. GFR is bad, less filtration. So, you know, it's just looking at creatinine for kidney is not enough. You need to look at the GFR also, because the GFR determines whether the kidney is functioning or not. Above 60 to 120, we are happy. We are okay saying, your kidney is functioning normally. It can handle all the waste that is coming and filter the blood and send it. The moment it starts dropping less than 60, we start getting worried because that's kidney disease. And we're not sure if we can reverse it or not at that point of time. If we find out the insult-causing mechanism, we can do it. If we don't, then it may just progress down, go less than 15, and that is kidney failure, meaning your kidneys stop working completely. And based on that, we classify kidney disease into 5 stages. So stage 1 is when there is some structural disease, but the GFR is a little high, it's normal, right? And then between 60 to 90, stage 2, then 30 to 60 is stage 3, 30 to 15, and so on. And less than 15 is stage 5 or complete end-stage renal disease, as we call it. Okay, so GFR is the key for us to tell whether the kidney is functioning well or not, and that's why we do tests on that. And at stage 1 and 2, it's definitely reversible. For some people at stage 3 also, it can be reversible, provided it's caused by either some medication or some infection. And we remove that, and then the kidney will start recovering. Or if the BP has gone low and then they've done it, we try to make sure the BP is up and then they recover. So it happens, yes. But beyond that, it's very difficult. The most common risk factor for kidney disease is diabetes. Okay, so it's not just about the kidney, it's about sugars. It's diabetes. 44% is diabetes. And the next 30% is hypertension. So control your blood pressure, control your hypertension. 75% of the kidneys are safe. If you're not, 75% of the kidneys are at risk. All the other diseases come in the remaining 25%. That's the big math. Okay, so you have to work on blood pressure and diabetes to keep your kidneys safe. No two ways about it. And there are other risk factors also. So not just this, you have tobacco use. People who smoke, again, are at risk. Heart problems or stroke, again, that means decreased blood supply to kidney. Overweight, being overweight, or family history, again, there is a risk. And toxins, of course. So toxins are always there. Toxins mean medications that affect the kidney, infections that can happen in the kidney, urinary infections, stones that obstruct the kidney, they can also affect the kidney, right? But the major ones are diabetes and hypertension, obesity, and heart problems. You can take care of those, and stop smoking. Smoking is definitely not good for kidney. Okay, so that's very, very important. The global burden of kidney disease, unfortunately, unlike liver, kidney disease is in the red in India. We are at the top. We are in the top. We have a lot of people with kidney disease, which is not surprising considering the number of diabetics that we have. So we are also number one in diabetes. So, and of course, behind China, but in kidney disease, we are ahead of China. We're number one in that. So it's a sad state of affairs. So a lot more protection for kidney is needed in India. And it is also expected to still grow. So India, again, is in a growing trend. It's going upward in terms of kidney disease. We're not coming down anytime soon, which is, again, very, very scary to note. And yes, again, looking at Southeast Asia and South Asia, kidney disease has been growing, right? And it has been growing faster than heart disease, which is the number one killer in the world. And in India also, kidney disease is growing faster than heart disease in India or Southeast Asia in general. So it's not a good thing at all for us. And we have to make sure we protect our kidneys. So this is the global burden of kidney disease. So there is a 134% increase in death from CKD when compared to 1990 versus 2013. 1 in 57 deaths in the entire world is due to chronic kidney disease. And of course, about 1 million or 1.2 million heart attacks were related to kidney disease. Okay, so there you go. So it's a big number. It's a really, really large number, and it is something that we must pay more closer attention to. And like I said, again, as we look forward and we project, again, we see there is going to be an 89% increase in incidence, 87% increase in prevalence. Death is going to increase by 98%, and disability due to kidney disease is going to increase by 63%. So this is not good at all, right? It's very, very scary. And this is data from 2018. So it's high time for us to focus on our kidneys and make sure that it is taken care of. Symptoms of kidney disease, yes, fatigue. People feel very tired. There's loss of appetite. And urine can be foamy or decreased in amount of quantity. And people may quickly keep going and passing urine again and again. And yes, in an advanced stage, they can also have a fruity odor in their breath. That is also possible. Of course, it's not going to all happen at the same time. It happens over time, and this is more important. If you want to focus on early symptoms of kidney disease, this is what it is. So there is appetite loss, fatigue, weakness, itching and dry skin, a lot of nausea, weight loss without any active attempt to lose weight, not able to be as sharp as you usually were, and some muscle twitching. So these are some things that we start thinking about, is that something that we need to check the kidneys for? And that's when we start checking the kidney. But routinely, as a habit, we always check the kidneys every 6 months or a year. I'm talking from a doctor's point of view. Whenever a guest comes or patient comes to us, we check it just to be sure, okay, nothing's happening on that angle, right? And of course, as it worsens, more and more symptoms start happening in kidney disease. Some common tests for kidney, just like I said for liver. Again, we have renal function tests that we use. We also do urine tests in kidney, unlike the liver, where we don't do any urine tests. Here we do urine tests as well. Of course, we do the ultrasound and the CT scan. X-rays we used to do for the kidney. Nowadays, we don't do too much of X-rays for the kidney because we find the CTs are better and give us more information, and so do the ultrasound. So this is what we do. And of course, if we need, we'll also get a renal biopsy, very much like a liver biopsy that we do. But here it's not for cancer. It's more for finding out the type of chronic disease that is affecting the kidney. So that's what we do for kidney. Most importantly, the most valuable part of this whole lecture is how to protect my kidney. Very simple and straightforward. Drink plenty of water. That's the best way to protect your kidney. Drink plenty of water and stay hydrated. This is before anybody develops kidney disease, not after. Once somebody develops kidney disease, they find it difficult to manage their water, so they must restrict their water. This advice is only for those who've never developed kidney disease, so their kidney is able to handle as much water as they take. So make sure you drink a lot of water. So there's no confusion there. Also, make sure you take a lot of fruits and vegetables, which are very healthy and they have high antioxidant level. which prevents any wear and tear and damage. And avoid processed food. Processed food is the food that's kept in the frozen section of your supermarket. It has a lot of salt in it because that's what is needed for them to preserve it, and some preservatives as well. And they're not good for your kidney, right? So processed food, salt, a lot of red meat, sugar, caffeine, they're all not good for your kidney. They put excess strain on your kidney and trouble it a lot. Avoid drinking alcohol or smoking cigarettes, okay? And keep blood pressure always under control, and so your sugar also under control. Exercise regularly, maintain a healthy weight, avoid obesity. And of course, like I said, all doctors love to periodically screen the kidney. So if your doctor says, oh, let's do a renal function test, don't say no, okay? So let's get it done. It's just trying to be on the safer side, so no harm. And it's a very, very cheap and easily done test. Okay, 7 ways to prevent kidney disease in diabetics, particularly. Work on your blood sugar goals and manage your blood pressure. Very, very simple. There's nothing more. And of course, consult regularly, stop smoking, stop alcohol, and start doing more activity, and eat right, eat healthy, okay? So this is how you protect the kidney. Okay, can NURA help? Yes, I have to tell you what NURA does and in relation to this. This is NURA, of course. We are an advanced center. We believe in the Japanese way of annual health screening, full body health screening, where we not just screen kidney, liver, we also do many more things, right? And of course, it's our hospitality is completely Japanese. We try to do the best we can for you in a nice, hospitable environment. Make sure you don't feel like you're coming to a diagnostic center. And it takes only 120 minutes. We try to give not just blood tests, but also a lot of imaging. The best technological advancement we have is our CT scan, which is ultra low dose radiation, which is, all equivalent to a chest X-ray. So you're not at risk at all with that. And it's just almost equal to the natural radiation you will get from the Earth's surface if you're taking a flight, right? So that's our best technological advancement. It allows us to do a better screening for you. And we can help you with the following when it comes to kidney and liver. We look at your kidney and liver functions. Okay, we also do an HbA1c to look for your sugars. We do a blood pressure check. Both sugar and blood pressure are important for the kidney. And we also look for any infections that you may have, which may affect your liver or kidney. We monitor lipids and cholesterol, which is very important for the liver, has to be controlled. The liver does a lot of work there. We also do imaging to check your visceral fat, and fat affects the liver for sure. And it affects the kidney also, but more so the liver. And we look at bone density. If the bone density is falling, it could also mean the kidney is having a problem. Yes, so we look at the bone density also, apart from many other things. And of course, this is a non-fasting test. That's the blood pressure that we check. And of course, the blood test is only partial, yes, and we add it up to some imaging. And this is how our kidney report comes. So you see the bun creatinine, of course, the uric acid, which is again excreted from the kidney, but most importantly, the glomerular filtration rate. I talked about the GFR, and we check the GFR. For whichever test patient this is, it is a very healthy GFR, and we don't want it lesser than 60. We want to keep it above 60, preferably above 90 is very healthy. We also look at the liver. So we see if the liver is able to produce proteins enough. We see if there's any damage to the liver cell. We also see if there is any alcohol-related injury to the liver. And going forward, we're also trying to get CT scan to be able to check the size of the liver, the size of the kidney, look for gallstones, look for kidney stones also. So this will be our next technological advancement in the next month or two. And we're going to go ahead with that as well. Okay, we also, like I said, look at visceral fat. We look at the bone density, and we see where your fat and your muscle is distributed in our scan. So you have a very clear idea of what goals you need to have in terms of your health. How do you need to work on your health? How do you need to correct it? And which areas? So you're not wasting energy in doing other things and focusing your energy on the right things. This is what we do. That's our DEXA scan showing the bone strength for spine. We also look at the femur. And this is called metabolic syndrome. Metabolic syndrome tells you your risk of developing heart attacks, high blood pressure, diabetes, and related illnesses like stroke or kidney disease can also be predicted with metabolic syndrome. So metabolic syndrome is bad. So this is how we present our report so you can understand your risk and take corrective action. Okay, that was a very quick summary of things. So the liver and kidney are two of the most important organs in the human body. And everything that enters our body affects or is affected by the kidney or the liver. So they're very, very important. They get the maximum blood supply for the very same reason, 25% to liver, 25% to kidney. And of course, even 30% of the liver or even just one kidney it will allow you to survive, but you don't want to reach that level. You don't really want to reach that level. You want to keep it protected. And most liver and kidney related injury is either preventable or reversible. It can happen, provided you catch it early and then remove the insult, and then it will become better. And being committed to a good lifestyle always is the key to not just good kidney and liver health, to overall health. Okay, so a couple of quotes I want to leave you with. Is life worth living? It all depends on the liver. And I trust me, when people have liver or kidney disease, the quality of life drops down drastically. And again, for people who develop kidney disease, there's another beautiful quote: behind every perfect person with a kidney disease, there is a beautiful and strong family. So be there, support anybody who has any of these diseases, because they need a lot of support. Well, I'm from NURA, and that's part of Fujifilm, where we never stop innovating, and we will continue innovating and bring you better screening tests for you to identify health problems early. What we ask you is to choose health. Thank you. I'm going to leave any questions slide in the end.
Okay, thank you so much, Doctor. There are, Mr. Desikan has asked, how do you detect a fatty liver? How do you treat it?
Right. It's a very good question. Yes. Fatty liver is a ultrasound diagnosis, or nowadays it can also be a CT diagnosis. Yes. So we look at the size of the liver and we see if the liver is uniformly looking the same, or does it look a little bumpy, lumpy, and then we decide, okay, that means that there could be fat deposits that's happening. So that's how we diagnose fatty liver. I already told you why fatty liver happens. It's basically injury to the liver or excess sugar that we have that's getting deposited. How do we treat fatty liver? The good news about fatty liver is that means you've identified injury to your liver early. So you have to identify the injury causing mechanism or organism. It is what you must identify. It could be alcohol, it could be sugars, or it could be high blood pressure, or it could be an unhealthy lifestyle that somebody is following. Like either they are putting on too much weight suddenly, or rapidly trying to lose weight, going for these crash diets. Suddenly they decided, I'm going to go keto, paleo diet, or God knows what. I mean, I don't follow diets. So yeah, forgive me if any of you are following that. But yeah, if you're following these crash diets, please don't. Whatever you're eating, make sure it's balanced diet and you eat healthy. You have 30% protein, 30% cholesterol, and 30% of carbohydrates in your diet. That's a balanced diet, which you can have with a lot of fruits and vegetables, and that will really help you to reverse fatty liver. So exercise, good lifestyle, control sugars, control blood pressure, and no alcohol. If there is already fatty liver, no alcohol. For those of you who like your alcohol, it's something you must do. And stop smoking. Smoking is bad.
Thank you, Doctor.
I hope that answers this question.
We're sure it does. Thank you. And if there's anything else, people can always write to us and we can get it checked with you. So Sheila wants to know, without any of these reasons that you mentioned about fatty liver, if anyone has fatty liver, what should they do? I mean, what to do, she's asked. I'm assuming she wants to know.
Whatever may be the reason, the answer is always the same. Unless there is a genetic cause for people to develop liver disease, it only is about, okay, something is troubling, I need to get to a healthy lifestyle. That's all. So in a healthy lifestyle, you just eat right, you exercise right, and that's about it. So exercise is important. Exercise is key here. It's not just about eating and being a good person. You have to make sure there is exercise. And let me tell you why I am saying there is exercise is necessary. One, because when there is fatty liver, part of the reason is damage. Part of the reason is that excess sugar is getting deposited there. So when I say eat right, it means you know what amount of calories you need, and eat that amount of calories. If your calorie requirement is say 1800 to 1900 calories, have 600 calories per meal. Okay. But if you tend to have about 2400 calories in a day, that remaining 500 calories is going to get stored in the liver, and that will become fatty liver. Okay. So eat right. But when you exercise right, what happens is that excess glycogen or fatty liver that's there, it will start taking it out. It will start giving your liver room to breathe. Yes. So it will start utilizing it and your liver will start coming back to normal shape. So whatever may be the reason, the solution is always eat right, exercise right, and lead a healthy lifestyle.
Thank you, Doctor. There are many talks about liver detox. Is it required and does it really work?
Well, there are a lot of ways to make money, okay, in life. Yes. I'm not saying everyone who talks about detoxifying the liver is bad, but you are the best judge. You have the knowledge. You do what is appropriate in your situation. Just don't blindly trust somebody and take some liquids or take some fruits or take some, food, thinking, okay, they're the expert and I'm going to do it. Unless they're a doctor, I'm not very sure if they're the expert in doing things. Yes, either they should be a doctor or a nutritionist or a dietitian, and they must have clear idea what foods are good for the liver or bad for the liver. Other than that, if it's a new fad and it's a new thing that everybody is doing, my opinion always is don't join the bandwagon. Know what your regular diet is and you follow that. And if you follow a healthy diet that you have consistently followed for a large part of your life, that itself will detoxify your liver. You don't need any special detoxifying agents separately for that. Yes, there are antioxidants which help. Antioxidants definitely help because your liver is the first port of call for all toxins you take into your body. The liver will try to handle it. So obviously it will get damaged. So, and this damage will produce oxygen-free radicals, which will further injure the liver. So if you take antioxidants like your green tea or other antioxidant substances, it may help, yes. But you're not going to survive on just antioxidants. It's just an additional boost for you. That's all. Other than that, you should have your regular diet.
Thank you for that, doctor. So the other question is, does GFR reduce with age?
Yes. Yes. One of the risk factors, I'm not sure if it was there on my slide, one of the risk factors for reduced GFR or kidney disease is age. As we grow above 60, unfortunately, the number of functioning nephrons starts coming down. So the glomerular filtration rate also starts coming down. When we calculate creatinine clearance or GFR, one of the factors that we put in there is age, because we understand that age will bring down the GFR. As a doctor, there's nothing that I can do to reverse it. But if you have lived your life healthy till the age of 60, there is no reason that your GFR should drop down drastically. Yes. So yeah, live now well so that you don't have to suffer after 60. That's important.
Right. Absolutely. There's a question that's come which says, what is a good alcohol intake level? Your slide mentioned ounces. Did not understand.
Okay, as a doctor, I'm not really supposed to advise how much alcohol to take or not take, unfortunately. Yes, what that slide basically mentions is that if you take, say, more than about 60 to 90 ml a day, you're going to hurt your liver badly. Yes, about 30 ml is going to be safe. But you never heard this from me, okay? Yes. But I'm just telling you, that's what we are taught as doctors, that if that person is consuming more than 30 ml every day, his liver is definitely getting damaged. If he's keeping it up to 30 to 60 ml, maybe he can get away with it. That's what, as doctors, we are taught. But I'm not telling you to have alcohol, right?
You're just calculating it into mLs.
I'm just calculating. That's it. Thank you.
So we'll move on to the next question, which is lifestyle change. Can lifestyle change help kidney and liver functions? You have touched upon these.
Definitely. Yes. Everything boils down to that. Control your sugars, control your BP, exercise right, keep your weight in a good, reasonable range. These 4 things, definitely. Plus eat right. That's all. 5 mantras to success for us, for liver and kidney health. Yes.
Okay, right. So the other question is, does medicine for BP and diabetes affect liver and kidney functions?
That's an interesting question. So what as doctors that we do is we look at, before we start anybody on sugar or blood pressure medication, we do look at their kidney function and their liver function. And then we choose appropriate medications for them, because there are some blood pressure medications that will decrease the blood flow to the kidney. So we avoid that in people who may have a tendency to develop kidney disease. On the other hand, there are blood pressure medications that are renoprotective or kidney protective. So when we preferably choose those medications for people who have a tendency or a risk to develop liver disease. The same with the liver as well. So we have the anti-diabetic medications that again are kidney protective or non-protective and also won't affect the liver too much. So then we choose accordingly. So are there medicines that will hurt it? Yes, there are medicines, but we don't choose them when we know that there is a risk. As doctors, we're very, very careful. That's why every doctor, when you go for your sugar or BP checkup, will say, go check your renal disease, go check your LFT, RFT and LFT, and then come back and tell me, I will write the medicines for you.
All right. Thank you, doctor. Jessie wants to know, how often do you suggest to do a kidney and liver test in a year? Should it be done once?
The LFT once in 6 months is enough. The renal function test depends. If you are over the age of 60, you can do it once in 3 months. It's a very simple test, so you can do it once in 3 months. And anytime you are at the hospital for any problem, I'm sure the doctor will always write an RFT for you. They will not always write an LFT because LFT is very specific, or a liver function test is very specific indications, but everyone will always write a renal function test. You can tell them, oh, I did it only 2 months ago, but they'll still tell you, I still want to find out what's happening, right? So if there's no reason for you to visit the hospital, once in 3 months, 4 months is fine. LFT, not necessary to do once in 6 months or once a year is fine. Unless there is, say, jaundice or excessive vomiting, some abdominal pain, then they will do a liver function test.
Thank you, doctor. Vijay Lakshmi wants to know, can you please elaborate on kidney stones?
Kidney stones, generally, somebody can have a genetic predisposition, like somebody in the family always gets kidney stones or has high level, so they will get frequent stones, or they should have a history of not drinking enough water during the summer season, so they've developed kidney stones. Usually they are small in size and they come out. And as long as they don't block the passage, they will not cause trouble to the kidney. It will only cause a lot of pain. But when it blocks the passage and doesn't allow the urine to go out is when it will put back pressure on the kidney and cause damage to the kidney. Okay, so that is why whenever a doctor checks for a renal stone or a scan, he wants to know if there is a term called as hydronephrosis. Hydronephrosis or hydroureteronephrosis, which means there is fluid filling up in the kidney, which will then cause back pressure damage. They will also check your creatinine to see if it is rising or not, which obviously means kidney is not able to function. The pressure is not allowing it to function. So these are the only reasons we will really start worrying about the renal stone, the back pressure effect. In that case, the doctor will immediately say, okay, break the stone, take it out. I need to operate immediately because it's stuck. And then it's best to go with the doctor. But if it's small and not causing any back pressure changes, you can wait for it to just come out on its own. Just take some painkillers because the pain can be really unbearable. So take painkillers and wait for it to come out. In a nutshell, that's how you deal with renal stones. What kind of stones? Of course, that's completely an academic discussion.
So, so Veena wants to know what is good for detoxification for liver. You did answer a bit of it in the detox one.
Okay, so to answer it better, okay, apart from the usual control your sugars and blood pressure and also exercise and reduce weight, you have to eat some things that are very, very important for you to eat is fruits. Eat a lot of fruits because fruits have antioxidants. So you have to eat whole fruits. Don't go and drink juice, okay? Juice is not having the same beneficial effect as fruits. So have fruits which have antioxidants. There's also fiber. It will clean up your tummy. So that will happen. So eat fruits and eat vegetables. But make sure whenever you get these fruits and vegetables home, you wash them so you remove all pesticides from them and then you can consume them. So that's fine. What should you not eat? Definitely try to go low on your fatty diet. The more fatty diet you take, the more strain on the liver, plus also red meat. Lesser red meat will allow you to not put too much toxins into the liver. And beyond that, again, is about medicines. All medicines that we eat have a first pass through the liver, right? So be very careful of taking non-prescribed medications and also make sure your doctor knows what they're prescribing for you and it's not toxic to your liver in any way. That's very, very important. Or if there is a problem in the liver, they shouldn't be giving something that will worsen it. So these are some of the things in a little more detail for you to understand how to detoxify your liver. That's pretty much in a broad sense, yes.
Okay. You've answered this question in your talk, but for everyone, if anyone joined in late, are there grades of fatty liver? Rukmini has asked.
Sorry.
Are there grades? Are there grades of fatty liver?
No. We don't have grading for fatty liver yet. That would get into too much of academic, as in See, fatty liver basically means there is liver injury and the liver is beginning to go in the direction of liver failure, right? Or scarred liver. We don't need to grade fatty liver to say, oh, it's this grade now. Oh, it's that. The fact that it is there itself tells you must now start reversing it. So as a radiologist or as a hepatologist, I probably would say, oh, I want to grade the fatty liver to see what is the level of damage. But for the general person or the general doctor, it's not necessary for them to grade fatty liver. It only tells them the liver is getting injured. Let's stop doing whatever wrong is being done to it. So that's important.
Okay, thank you for that, doctor. Okay, the other question is, doctor, it's again alcohol related. Doctor, your opinion on red wine without sugar from cold countries?
I wouldn't even know how to answer that. Red wine without sugar in cold countries. So first and foremost, it's not the sugar in the wine that's really affecting. It is, of course, the alcohol by itself that we are taking that is putting a demand on the liver to handle it. It's as simple as that. And any alcohol that we take will put a strain on the liver, be it red wine or white wine or hard liquor or beer. It will put strain on the liver because the liver has to handle the alcohol that's coming in and the enzymes and react to it. But if you take in a small amount, the liver is able to handle the injury well and regenerate enough to not let the damage progress. If you take in a larger amount, the damage may not become appropriate or healed before you take the next dose of alcohol, right? So that's how the liver gets injured. So it's not that any kind of alcohol from anywhere is not going to touch your liver. Every alcohol, wherever, from whichever part of the world you take it, is going to affect the liver. Just your moderation in using it is what will help. Plus, the alcohol content per se, I mean, some of them have a higher alcohol content, some of them have a lesser alcohol content. So the ones with the lesser alcohol content will not damage the liver so much. The ones with the higher alcohol content will damage the liver more. Like hard liquor is more dangerous than wine per se.
Okay. Speaking about...
I suddenly feel like an expert on alcohol.
Well, I guess we all have, queries on, in our mind that we want answered. So
Right.
Talking about food, is intermittent fasting good for us? A lot of people are doing that these days. So is it good for us?
The human body is a lover of habit, to be very honest. If you have been a vegetarian all your life...
Just interrupt you there. I'm so sorry. I just saw the next question. Is fasting beneficial? Both are one after the other. So if you'd like to answer both in one go.
Let me answer that question first. Is fasting beneficial? Yes, it is. Fasting is beneficial. That's why all religions, most communities in the world promote fasting in their own different ways. Yes, it gives your body a period of rest to detoxify, to relax, rejuvenate. Yes, it does. So the second question, the direct answer is yes, fasting is beneficial, provided we don't overdo it. Provided we are not starving ourselves. We're not saying, oh, beyond 12 hours also, I will continue fasting and not eat anything. I mean, of course, I'm a Muslim. So in some countries, we have to fast 20 hours. Yes. But yeah, that's for a certain, if it's for a month. But if you overdo it, you extend it beyond 24 hours, then it's going to damage the body and it will cause fatty liver. Starving will cause fatty liver, by the way. But intermittent fasting. So coming to the first question now, see, like I said, the body is a lover of habit. If I've been a vegetarian all my life, then suddenly if I become a non-vegetarian, my body is going to find it difficult to handle it. If I've been a non-vegetarian all my life and suddenly I try to become vegetarian one day, my body is going to again find it difficult to handle it. So it's not that, oh, this is good, so I will follow it today, and this is good, I will follow it tomorrow. Whatever you have consistently followed all your life, when you continue that, your body finds it easy to handle. But if you suddenly give it a different system to handle, it takes time to adapt. So because you hear about intermittent fasting, there is no need for you to try it. You must try it if you have the right guide, the right guidance, and the right reason to do it. Don't do it without a reason. Don't do it just because you hear it and it's the latest fad. Don't do it. Absolutely not, because you are going to it's like saying, I studied medicine all my life. Today, they're suddenly telling me, go sit and learn engineering. It's going to be really, really difficult. Maybe as a child, it's fine. But at my age, I'm going to find difficult to learn engineering, right? It's the same for the body. I've had 3 meals a day, every day. Suddenly, I'm saying, do intermittent fasting. Why? is my body's question to you. Why is my body's asking, why do you want me to do intermittent fasting? You should have a reason. You should probably say, I'm having diabetes, which is not getting controlled, so I've been advised to do this. Or I'm overweight and obese, and this probably might help. Or something that I'm trying to do. Otherwise, just because everybody is doing it, there is no need to take up a fad. If your body is doing fine just the way it is, let it be. Don't change your habits. That's the advice. But yes, fasting is good. Only do it if there is a reason.
Right. Thank you very much, because many of us are now trying it out. So that's great to know about intermittent fasting. So Rukmani wants to know, as vegetarians, we are usually insufficient in vitamin D. And with old age, there is a calcium deficiency. So can we be susceptible to liver disease, even if we have none of the causative factors that have been mentioned?
Okay, so let me correct a few things in that. Vegetarian or non-vegetarian, you're not going to be deficient in vitamin D. Vitamin D is produced in the skin, it gets metabolized in the liver and the kidney, and it will absorb your calcium from the gut. Yes. So the vitamin that we will be deficient in is vitamin B12, because B12 is predominantly found in meat. Okay. So you can take B supplements. Vitamin B supplements are harmless because all the excess vitamin B and C will go out in the urine. So you can take as much vitamin B and C if you want as a tablet. Is fine, no problem. You cannot take vitamin D as much as you want because it is a fat soluble vitamin. Excess will get deposited in the liver and cause damage. Okay. So be very careful when you're taking vitamin D supplements. Don't take it without a doctor's advice. I'm saying this because during COVID, it has become a fad for everybody to take vitamin D. It's not such a safe drug to take. Okay. B and C, take anytime you want. You're vegetarian, you want to do your vitamin B12, go take B and C. Excess will go out in the urine. Vitamin D only on a doctor's advice, only on a doctor's prescription. If you're a vegetarian, you still get sunlight, so vitamin D is going to be there, number one. The second part of the question, as you go to old age, yes, there is a calcium deficiency. That happens because of the hormonal changes that you're undergoing in the body. Okay, once your estrogen, progesterone level drops, more bone will start getting resorbed. So at that point, your doctor will give you calcium supplements for sure. And they may also give you vitamin D supplements to make sure the calcium is absorbed properly. But that is only under a doctor's prescription. Okay. Now, will this affect the liver? Yes, if you take excess vitamin D, it will affect the liver. It's the simple answer. Other than that, there is no reason for your liver to get affected. Your liver will function just fine all through your life, unless we are insulting it in some manner by either alcohol or an infection, or these are the two most common reasons: alcohol or infection, if you're insulting it, or toxins like medications. Other than that, your liver is designed to function till the end of your life. It's not designed to function or get damaged. Unlike the kidney, which starts going down, liver does not. Liver works throughout.
Thank you very much, doctor. The next question is, just a moment. How about PSA test?
PSA, prostate-specific antigen, is done to detect prostate cancer. Who is at risk of prostate cancer? People above the age of 60, males, men. Men who are above the age of 60 can have a risk for developing prostate cancer. So for them, doing a prostate or PSA regularly is definitely worth it, because prostate cancer is the third or fourth most common cancer in men. Okay. So regularly get the PSA done once in 6 months or once a year, depending on what your level was in the last test. Keep getting it regularly done. Now, the PSA is only for prostate cancer. It will not be affected if the prostate is enlarged, which is a more common problem than cancer. Okay. For that, you need an ultrasound, and also that will reflect in getting up at night to go for urine or to pass urine, or having frequency of urine, like urge to pass urine very frequently. So these symptoms will be there. This means the prostate is enlarged. It need not be cancer. We do the PSA to find out whether there is a risk of cancer or not. So an ultrasound and PSA are good tests to do after the age of 60 to check for the prostate.
Thank you very much. Is there a way of removing stones in the gallbladder? And what would be the effects of the removal of gallbladder?
We cannot remove stones from the gallbladder. If it has come down into the bile duct, the pipe below the gallbladder, then we can put a scope and take it out. Otherwise, stones in the gallbladder, if they're causing too much trouble, the only way to remove it is remove the gallbladder itself. So that is why people do the gallbladder surgery or cholecystectomy, as we call it. So we cannot remove stones from the gallbladder. Once there, it's there.
Okay, thank you. Is Japanese matcha tea good for you? Benefits of that, please. Is that something you'd like to answer?
Apparently it is. It is high on antioxidants. So it will reduce your risk of developing liver damage, kidney damage, also reduce risk of developing colon cancer. But I am not the expert on matcha tea, right? I just know as much as you know that there are antioxidants that may help if you're drinking matcha tea. I cannot say it's not good for you because I'm not the expert, right? If you like it, you can drink it for the antioxidants.
Absolutely, yes. What
I think
about
it's a little expensive.
Yeah. So Jayashree has asked, what about dairy products? Are they good for the liver and kidneys?
In excess, they are not good. As in, like, not for the kidney, for the liver. Dairy products have fat and they have no effect on the kidney. Yes, they are a good source of calcium. So if you want your bones to be strong, you can take your dairy products. I don't mean sweets, I just mean milk, right? But it does contain fat. Unless you're drinking skimmed or toned milk, the level of fat is down, but otherwise there is there. If the liver is functioning well, you don't have to really worry. It will handle it, no problem. If the liver is not functioning well, then you will have some problems digesting the dairy product. But rather than affecting the liver, what you will notice more often if you have it is something called as lactose intolerance. When you have a dairy product, you will have diarrhea, you'll have a bloating sensation in your stomach, you'll have a lot of gas. This itself will tell you that the dairy product is not good for you. Otherwise, there is no reason that the liver should not be able to handle the milk. Again, it's or dairy product. Again, it's the quantity. If you are doing it in moderation and you've done it all your life, like my mother made me drink milk every morning as I was growing up. So if I continue to do that even now, it's not going to affect me in any way. But I never had milk all my life, and suddenly one fine day I started to drink milk every day. Then I'm going to find it a little too much to take because the body is going to try to get used to it.
K2 required for vitamin D to be absorbed by the body?
No. K is required for us to produce clotting factors. All the vitamins are independent of each other. Okay, so D is separate, K is separate, E and A are separate. So they do their own thing. They're not interdependent on each other. K is produced in the liver, and if the liver is not functioning, then the K will not be produced, and then we'll have to take it from outside. Otherwise, there is no need for you to take vitamin K. Your body produces sufficient vitamin K from the liver. So don't have to take vitamin K supplements at any point of time. It's not needed. Only when the liver is damaged or people have bleeding tendency will they give vitamin K. That's all.
Okay, thank you. So Kanchana, what lifestyle change do you advise for enlargement of prostate?
Unfortunately, there is no lifestyle change once the prostate is enlarged. Yes, the best you can do is to avoid urinary infections, and that means having a good hygiene of the private parts. So if there is a good hygiene, then urinary infections can be avoided. So because if the infection is there, it will worsen the problem, and then it will make you go to hospital because you will not be able to pass urine. But once it's enlarged, there's nothing we can do to bring down the size other than operate and take a piece out of it. That's all there is. It's a slow process over many years, and there's nothing that we can do to reverse it. Of course, there are tablets that the doctor will give to help with the flow of the urine and the force of the bladder. But without those tablets, there's nothing we can do.
Doctor, a lot of, you're getting a lot of compliments for explaining in layperson's terms. Daisy says you have explained so well in layman's language. And, so that's, thank you, doctor, for the clear answers.
Thank you so much. Very kind of you. Thanks.
So there's one question which says, how are heart attacks related to kidney disease?
That's a very interesting question. So what happens is it is a double whammy. Number one, the kidney is not able to push out water. So there is a lot of excess water that is circulating in the blood. And this puts a lot of strain on the heart. The heart is unable to pump this out. So it progresses slowly. It becomes weaker and weaker and goes into heart failure. That is number one. Number two, also remember there is a hormone I told you, which the kidney releases, which regulates blood pressure. So now suddenly this hormone has gone missing. So the blood pressure regulation has to be done directly by the heart itself. So that also puts more strain on the heart. So these are two reasons why people develop a weak heart when they have kidney disease. So they go more often towards renal failure. And this excess volume starts flowing, how do you say, turbulently. There's not just streamlined, smooth flow is not there. It starts flowing turbulently. And this tends to start creating clots, a clotting tendency, which then can also trigger off heart attacks for people, right? But more than heart attacks, the risk of developing heart failure is very high for people. And it's an intrinsic relation. Kidney and the heart are very closely related to each other.
Okay, thank you. Many of us were not aware of that. So thank you for that. There's one last question which I have here, which says low salt in, okay, I think this means that which are the foods which have less salt? I think that's what this question means.
Foods generally have less salt. We add salt.
Yes.
I mean, if you're listening, yeah? Food doesn't have salt. It's like that brinjal doesn't have salt, the tomato doesn't have salt, the meat doesn't have salt. It's the salt that we add for the taste that starts troubling us. Yes, some of them have electrolytes. There is a higher potassium content that we see in certain foods. Yes, but generally we add salt for taste, and some of us like more salt, some of us like less salt, and some of us are okay with it. When we say reduce the salt, it is the excess salt that you sprinkle on your food that we ask you to reduce, not the food itself. So that's what doctors mean when they say, so they tell you to keep your salt intake to less than 2 grams per day for kidney disease people. But otherwise, for a normal person, it can be anywhere between 4 to 8 grams a day. So that's for a normal person, right? So that's where the salt comes from. So don't worry about the food that you're taking. It's more about the salt that you're adding to the food.
Thank you, Doctor. Yes. Thank you very much, Doctor, for another very enlightening session. And thank you all for joining in.